Our pets are helping us get through stay-at-home directives, social distancing, and other changes to everyday life. But as we protect ourselves, some veterinarians are worried that we're not doing enough to protect our best friends.
A lot of people are adopting puppies during this time.
The joy a pet brings to a home is indescribable. While they give us humans emotional support, dogs rely on us to take care of them. Blue Pearl Pet Hospitals are noticing an alarming trend. Nationwide in 2020, they're seeing a 70% increase in cases of parvovirus in dogs compared to their stats over the past 5 years.
I think it's probably multifactorial.
Dr. Lenore Basic with Blue Pearl believes there could be several factors at play. They almost all have some connection to the pandemic.
If people are, staying at home and have strict stay-at-home orders, probably vet visits aren't necessarily the first thing on their mind. Financially, some people probably took a very large hit to their normal finances during this time, and again, perhaps routine prophylactic vaccines weren't necessarily a priority.
Dog owners may also be taking their puppies outside before they're fully vaccinated, and dog parks are a breeding ground for this virus.
Just assume it's in the environment and don't take your puppy somewhere where other dogs have been.
Symptoms of parvo include vomiting and diarrhea, fever, abdominal pain, decreased appetite, weakness, and weight loss. While it is treatable, that cost is much more than a simple vaccine.
With aggressive treatment, so hospitalization, IV fluid therapy, supportive care, the survival rate is very high, so close to about 90%.
Parvo can't be passed to humans, but another concern for vets is if this vaccine is skipped, are others being overlooked?
We do worry if they're not getting parvo vaccines. Are we also missing things like rabies vaccines, which could have a public health implication?
Life may be changing all around us, but nothing has changed about the needs and care for these important members of our families.
We just want to make sure as the first wave continues, a second wave comes, that vets are still seen as an important factor in public health.
This virus can survive on things like grass for months. It affects puppies the most, but parvo also impacts adult dogs. That's why boosters are recommended every 3 years. In Salt Lake City, John Franke, Fox 13 News, Utah.